Pulmonary Hydatid Cyst is a parasitic infection caused by Echinococcus granulosus, a tapeworm responsible for the formation of cysts in internal organs. In adults, hydatidosis is primarily located in the liver, while in children, the most common location is the lungs. The infection may be asymptomatic at first, and often the diagnosis is made late, when the cysts have grown large enough to cause symptoms or complications. Clinical signs are often non-specific and may include chest pain, coughing, or signs of infection. Hydatidosis remains endemic in certain regions of the world. Complications such as cyst rupture can be severe and are often the first indication of infection. These complications may lead to serious allergic reactions or secondary infections. Humans are accidental intermediate hosts in the life cycle of Echinococcus granulosus, which normally infects sheep, the definitive host. Contamination in humans occurs through the digestive route, mainly by ingesting the parasite's eggs. There are two types of transmission modes: a direct transmission through close contact with infected dogs. Infected dogs excrete eggs in their feces, and once ingested by humans, these eggs can transform into larvae in the intestine. And indirect transmission by consuming water or food contaminated with the feces of infected dogs. Transmission may also occur through contact with contaminated objects, hands, or clothing. The parasite reaches the lungs after passing through the hepatic filter, cause the liver being is the most common primary site. Sometimes pulmonary infestation can occur directly through the lymphatic pathways, bypassing the liver. The cyst gradually develops in the lung, exerting pressure on the bronchi and pulmonary parenchyma. This may lead to bronchial erosion, which is a constant feature in the evolution of pulmonary cysts, and other severe complications such as cyst fissuring, secondary infection, or rupture of the cyst, which can cause a secondary dissemination to other parts of the body, and more severe complications, which is the anaphylactic reactions due to the release of cyst contents containing antigens capable of triggering a severe allergic response. The pulmonary hydatid cyst enlarges over time, potentially leading to bronchial obstruction or major respiratory problems if left untreated. On the other hand, calcification of the cyst is rare but may occur in cases of chronic evolution or in the late stages of infection.